I'm doing my intramuscular Z-Track injection video, and before I started, I would make sure I had the right patient, right medication, right dose, right route, right time, and right documentation, and I would perform hand hygiene. I would verify my orders, and the orders are he gets 1 gram of Rocephin IM, and we're doing it in the vastus lateralis. So I would go into the medication room. I would get my Rocephin and the normal saline. I already have mine reconstituted, but I'll explain how I did it. So I would wipe these off, the top of the normal saline and the Rocephin off, and I would get my needle because I'm going to do the 500 milligrams per ml. So I would get my needle, and I would withdraw 6 mLs of air out of the Rocephin and insert it into the normal saline. Then I would withdraw, that makes room, and then I would withdraw 6 mLs of normal saline, add it to my Rocephin, and then I would roll my medication to mix it very lightly to make sure it's all mixed, and it's all mixed. So then I would dispose of this into the Sharps container and throw these in the garbage, and then I would clean the top of the vials again, and I would get the needle that I'm going to use to insert the medication. And it's a 3 ml 22 gauge and a half needle. And then I would throw this away. And I would withdraw it out of my Rocephin. Would withdraw 2 mLs. Make sure I got rid of any air bubbles. Then I would get my medication, go into the patient's room, perform hand hygiene, and verify with the patient who they are. So he would state his name and his date of birth. He's Skip Rocker, and his date of birth is 1/1/1972. So I'd wash my hands, put my gloves, explain to him what I'm going to do. I'm going to do your Rocephin IM into the vastus lateralis. So I need you to, and he has a ulcer on his right leg, so we're gonna use his left leg. And we're gonna use his right leg because it's on his left leg. And so I would have him lay supine and with his knees flexed, and then I would locate the muscle, and it's located at the middle third. I would use I would clean the area with the alcohol swab. Start in the middle, going out, and then I would dispose of that, and I would use my non-dominant hand. I'll take the needle out. I would use my non-dominant hand to pull back and hold tight, and then I would go at a 90-degree angle into the muscle, and I would aspirate for 5 to 10 seconds. So, and there's no blood return. Then I would inject over 5 to 10 seconds for the medication. Then I would pull out and let go at the same time. Recap my needle and throw it into the Sharps container. Get rid of my gloves and ask him if he tolerated it well, and he said he did. I would make sure that there is no blood or anything on the injection site, and then I would go document the time I gave the medication, the dose to which patient, and at which site I gave it. And that's all.